Researchers at the University of Oxford have come up with a global comparative grid comparing the intensity of the lockdown in India with that of 73 countries across the world. I'm joined on the broadcast live from the United Kingdom at this time by Toby Phllips. He's the head of policy and research at Digital Pathways at the University of Oxford. Also with us, Manikarnika Dutta. She's a female medicine historian. Both of them joining us now on the broadcast. So welcome. I want to show you first what the study says, and then we'll try and make sense of what this means for you and me. So let's go across and show you what the Stringency Index put together by the researchers at the University of Oxford shows, and then we'll talk to the people who've been instrumental in bringing it together. So here it is. What this study essentially says is that if you compare countries like the United States, Italy, Spain, China, the United Kingdom and others, India has, can we take this data set on our screen? India has the world's most stringent lockdowns. In their index, India actually scores 100. Italy comes in at 95.2, Spain comes in at 90.5, South Korea at 81. If you look at the level of stringency of the lockdown, India has, ladies and gentlemen, the most stringent lockdown in the whole world. Toby Phllips, I'll come to you first. When I see this and I see India score 100 and 100, in India we love academics, we love scoring 100 and 100, but when it comes to the intensity of the lockdown, if we're scoring 100 and 100, I'm wondering, is that a good thing? Is that a bad thing? Are we too stringent in this lockdown? How do you look at the lockdown in India in the context of lockdowns elsewhere?
So I think the important thing to remember is that India isn't the only country scoring 100 out of 100. So there's also South Africa, New Zealand, Croatia, Thailand are all up at that level. And I think it really depends on, to your question, is it a good thing or a bad thing? Well, it depends on what you think about the things that we measure. So we're measuring things like, are the schools closed? Are the borders closed? Are people able to go to work, or are people asked not to go to work? The reason we're measuring those things is because these are the types of measures that countries are taking to try to contain and stop the spread. And certainly what we see with India is that on our scales of measuring those sorts of indicators, those sorts of policy measures, India is currently taking some of the most strictest possible measures on all of those dimensions. In terms of containing the virus, it's a little bit too early to say whether these measures are truly successful. We're starting to analyze the data and to see whether a high stringency is indeed correlated with flattening the curve and slowing the spread of the virus. I think the difficulty is that there's about a 2 to 4 week lag between taking a policy measure and actually seeing results.
What does the data available so far say? Is there a direct positive correlation between the stringency of the lockdown and the flattening of the curve? It hasn't been visible in India so far, but if you were to look back in other countries where you've had that 3-4 week period, what does your data show?
So at the moment, the data shows that there does seem to be a relationship after about 2 to 4 weeks. So I think, what we would hope to see in India will be, a really important case, because I think you're at about the 2 week mark of the very strict lockdown. So we'd expect to see over the next 2 weeks from now, changes in the new rates of deaths and cases. But I would say we've only had a small number of countries that have had a lockdown for 4 weeks so far. So our analysis is based on looking at just a small subset of all the countries in the world at the moment.
So Manikarnika Dutta, there are two things our viewers are interested in. First and foremost, of course, how intense the lockdown is. Second, and more important, how effective that lockdown is proving to be. You're looking at what's happening in India. You're also comparing this with what's happening in the United Kingdom, elsewhere. How do you think the lockdown in India is faring? Net, looked at in a global context, where does this Indian lockdown fit in?
Hi, so yes, as you said that, it's very important to know that, this study that, Oxford, that COVID-19 response tracker, it's just that this is kind of based on like the measures taken by the government. Now, it's very important to note that there is always a big, gap between what the government kind of, the measures that they take and what is actually practiced in reality. So I think that's another thing that that we need to kind of consider in order to understand how far this particular data this lockdown has been successful. And as far as you mentioned that that there has been a lot of stringent measures that have been taken up, of course, yes. But we are a kind of country of 1.3 billion people, and cutting across different social stratas. So we need to kind of look into how to kind of make this lockdown, which is obviously not going to be a very easy thing to do, but how to make it possible that everyone, like every individual, like coming from different classes of the society, they don't kind of suffer. So this is something very important. So on one hand, definitely you need to take very strict measures, and I've just kind of checked that the government has kind of come up and they have extended the lockdown in several states, and they have kind of identified hotspots. But at the same point of time, you need to kind of consider how you're going to practice this lockdown. How you're going to how the measures are going to be implemented.
Toby, you're looking at the intensity and the stringency of the lockdown, but I'd like to question that very idea, because in countries like South Korea, in countries like Sweden, in the countries like the Czech Republic, they don't have a complete lockdown, and yet they're doing fine. They're doing reasonably well. They're being able to flatten the curve. So of course, the stringency of the lockdown is one very important criteria, but it isn't the one determining criteria, because there are other ways in which you can flatten the curve without going the whole hog and shutting everything down.
Yeah, that is 100% correct. And we're actually just over the last week have been adding new information to our database around testing and contact tracing, because in the countries that you mentioned, particularly, I think South Korea is a great example. Their policy was less about lockdown and containing the broad population, and much more about testing as many people as possible, about tracing as many people as possible, and then when they find cases, really locking them down. And so, in South Korea, they've got these sort of government-run quarantine facilities where people that come off planes get put while they're waiting for testing, and that's a really important part of the response. I think, looking at India, with such a big country, India's currently testing about one person for every 10,000 people. South Korea's been testing 100 times that amount. I think it's difficult, though. South Korea's got a much smaller population. There just may not be the capacity and the testing available for a country of India's size. So it's really difficult when you're looking at that scale of people to trace the infection person by person, but really that is the best way to understand and contain it. I would say to Mani's point, it is really important to think long term about this, because we probably, from talking to kind of the epidemic scientists, it's probably going to be years before we have a proper vaccine that's widely distributed and can stop COVID. So we'll be living with this for a long time.
Manikarnika, you've got family here in India. You're looking at the lockdown in the United Kingdom. What's your own sense of how the Indian lockdown is faring vis-a-vis what you're seeing around you in Europe, your own personal experience in the UK, and what you're reading about the rest of the world?
Hi. So just to take your previous question, when you were asking me about the stringent policy, I think definitely there are two things, which Toby kind of touched upon. One was the social distancing, and the other is the number of testing. So I think one thing that India definitely needs to do, because I think the last time I saw the data was like 93. There were like coming from a million, there are only 93 people being tested. Am I right?
So about 40 when we last said, but go on.
Yeah, so I think the number of testing is not enough. It's definitely not enough. So we definitely need to kind of increase the number of testing. And also one thing we need to understand is that, in a society like ours, if you don't, kind of come up with stringent measures, people are going to sometimes, abide by rules. So it's very difficult to kind of get to people to understand what this entire lockdown is about, and how serious this is. So I think this is something that we need to kind of explain to people, that it is very, very important to kind of abide by the rules of the government and what they're saying and why they're saying. But at the same time, government also has to kind of note the problems of the people at the ground. And as far as you questioned about my family, see, it's very difficult, because recently my father wasn't well, and so I was speaking to doctors. So one of the doctors kind of mentioned to me two factors. One thing was like he really regretted the fact that there was this particular hospital in Calcutta, and that that they kind of do these. It's a dialysis center. So in this particular hospital, there were these 2,000 patients who kind of undergo dialysis every week, and that is now closed because there were three COVID patients, COVID positive patients that were kind of identified. So the entire center was kind of closed down. So what happens, to those patients? So we are always kind of talking about COVID-19 infected patients, but what about the rest? There are people who are kind of suffering from several other diseases. So I just want to kind of request the government also to see to it that they are not neglected.
Sure, I think those are important points. Toby, Phllips, Manikarnika Dutta for joining us from the United Kingdom with your thoughts on the Oxford University's Stringency Index, the government response tracker, which looks at how the Indian government's response to this lockdown has been vis-a-vis the responses that are being seen to the pandemic in different parts of the world. Thank you very much for joining. Hello everyone, this is Rahul Kamal here. Hope you enjoyed this video. For the latest news and analysis, like and subscribe the India Today YouTube channel, and don't forget to press the bell icon to stay updated.